Hello, everyone. Thank you for joining us today. We've just clicked admit on the waiting room, so we'll just bear with us for a couple of minutes whilst everyone filters through. In the meantime, please do introduce yourself in the chat, say hello, where you're joining from today, and start the conversation between yourselves, and we will get started very shortly. Right, fantastic. That's showing as the majority of everyone filtered through, and we want to get started. So, hello everyone. Thank you for joining us for this special Sick Day Rules webinar today. You are joined by the Addisons Disease Self-Help Group and the Pituitary Foundation, and of course, Aldons, our endocrine specialist nurse. Next slide, please. So, Zoom housekeeping. Going to start with all the usuals, which you'll be very familiar with. So, this session will be recorded and available on both charity YouTube channels after the event, so you can catch up. Please do say hello and introduce yourself in the chat, as so many of you are already, which is great. Say where you're from. It's always lovely to see who's joining us. If you have any extra questions, remember to put those in the Q&A box, not the chat box, because that just helps us with the quantity of questions we receive. And please remember that we can't answer direct medical questions specific to your own health. We ask for you to answer the more broad questions. And of course, we will do our absolute best to answer your questions. And remember to check out the resources on both our websites. But of course, today's session would not be possible without our endocrine clinical nurse who is joining us today. Aldons, would you like to introduce yourself?
Yeah, hello everybody. Good evening, and thank you so much for joining us tonight. Yeah, I'm Aldons, and I am a clinical nurse specialist in endocrinology. I work in one of the tertiary hospitals in London, and I also work with the Pituitary Foundation as their endocrine nurse. So welcome everyone.
Thank you so much. And then next slide, please. So you are also joined, as I mentioned, by the Addisons Disease Self-Help Group, which is myself, but handing over to the Pituitary Foundation to introduce themselves. Pat?
Thank you. Hi everyone, thanks for joining us. It's really good to see so many on board tonight. So the Pituitary Foundation, as part of this collaboration with the two support groups, we have a team of 11 staff, including our Aldons. We have 20 medical experts, 20 plus on our medical committee, and we have over 80 volunteers. So our support services include an endocrine nurse helpline, a volunteer-led support helpline, and an email helpline. We have support groups across the country, and the next slide will show you a new map that we've installed on our website to show you the quickest access to your local support group. We have condition-specific telephone buddies you can speak with on the phone, and we have up-to-date health information online and in print. Our psychological support and counselling service is fairly new this year, and we also have a web page to support with psychological help. Our events are online and in person throughout the country, and this is an opportunity to meet others in your community and hear from medical experts on various pituitary issues. Also, of course, fundraising opportunities. There are ways to get involved for all and ensure the future of the charity. We're 31 years old this year, young this year, and our vision is for all people with pituitary conditions to live well now and in the future. Next slide, please. So this is a snapshot. On the left, we have our Pituitary Life magazine, which is for members, a bonus of our membership. And it's our 60th edition, this current edition, which is going out soon. We have online events, which you can see Aldons, of course, covering this event for us, presenting. And we have various talks over a wide range of pituitary problems and things that people really want to know about. And up on the right is the map with all our support groups in the country. If you go onto the web page, click on one of those colours on the map that's nearest to you, and then you can find the details of the group where that is. And the lower picture is our recent Leicester get-together, and we're about to have one in Southampton too. Thank you.
Great. Thank you, Pat. And hello from the Addisons Disease Self-Help Group. So my name's Philippa, and I'm from the Addisons Disease Self-Help Group, funnily enough, and I'm here to talk to you about what we do as a charity. So we envisage a world where Addison's disease and adrenal insufficiency are recognised early and managed effectively so that anyone affected can live and confidently and thrive. And we're delighted to collaborate together as two charities that support people with adrenal insufficiency, which sick day rules affect both of our conditions. So it's fantastic to be together today. So from the charity, we support people through our website. This is personal stories and blogs, news and articles, leaflets and publications, which are free to download or buy in our hospital packs if you don't have access to a printer. The online shop goes above that, up some more with different steroid dependency resources. Information for your healthcare professions, as we all know that this is an area where education can sometimes be a bit of a downfall. We fund research into the condition, most of all the EpiPen and things like that. People are always very excited to hear more about on our website. We offer paramedic training, in-person events, the online members forum, so you can speak to people 24/7. And then if you choose to become a charity member, thank you so much. That supports our work further. And you get a lovely welcome pack pumped full of information, of leaflets and publications. And if you can't afford membership, we also offer sponsored membership so that there's no barriers to anyone getting the resources they need. Okay, next slide, Aldons. And these on the left, just quickly, are some words that you guys have let us know what the charity means to you, which means so much to us, knowing that you found it reassuring, confident, supportive, safe. We're supported by our Addison's clinical advisory panel, so you know that the information you receive is expert and you can trust it. And also what means a lot to us is knowing that our materials have helped you in different situations. And on the right is how that they've helped you in emergency care situations. But now really want to get started on the bulk of the presentation. So moving on and over to you, Aldons. Oh, I forgot about it. Oh my gosh, how could I forget about Addison's Disease Day? It's been my world for however long. And Aldons too, as he is hosting a stand in his hospital tomorrow. Well, an all-day stand, which I'll let him talk more about. But tomorrow is Addison's Disease Day, which is the very reason we've collaborated to bring this session to so many of you. And we can't make it a success without you. So keep an eye on all of our socials tomorrow. Share everything you can. If you do use social media, start a challenge, donate if you're able to. Everything you can do to help raise awareness and bring us all together will improve the lives of everyone affected with Addison's disease and adrenal insufficiency. So thank you very much.
Okay, thank you, Philippa and Pat, and thank you to both the Pituitary Foundation and the Addisons Self-Help Group for having me tonight. I would say today to some of our attendees from Australia and the US. I don't know what time in Australia right now, but yeah, we do have a variety of attendees across the globe. So yes, so tonight I'm going to be sharing with you the sick days or stress days, as some of them would prefer that term. It's mainly a reminder for those with adrenal insufficiency on how we manage this condition effectively. So if you have some questions later on, you can pop it down on the chat, and then we can also discuss about some of the frequently asked questions. Okay, so first things first, what is adrenal insufficiency? I'm sure to most of you here, we have a variety of different pathologies of adrenal insufficiency. But when we talk about adrenal insufficiency, it's basically an inadequate production of cortisol. So cortisol is our natural steroid hormone that's produced mainly from the adrenal glands. And we then established that there are three main different types of adrenal insufficiency. So if the affected area is the adrenal gland, then that's when we call it as primary. And if it's secondary, that's when the pituitary gland is affected. And then tertiary is when it's the hypothalamus. So it's important to understand these pathologies because the management of adrenal insufficiency varies slightly. I would say slightly because basically any pathology, the main treatment is steroid replacement, and everyone is at risk of a life-threatening event called adrenal crisis. So for primary adrenal insufficiency, mainly it could be due to Addisons disease or congenital adrenal hyperplasia. For some patients who also have adrenal surgery, so we can classify them with that. We have secondary adrenal insufficiency where patients get empty-cellular apoplexy, and some patients who get pituitary surgeries as well. And then hypothalamus is mainly if patients get exposed to prolonged steroids over time. So these are patients who have other conditions such as asthma or dermatological autoimmune disorders that they've been treated with steroids for a long period of time, causing the suppression of we call it as the HPA axis or the hypothalamic pituitary adrenal axis. So moving on to the manifestations, we have the signs and symptoms. These are the classic signs and symptoms. So I could explain to you, I could tell you like a whole long list, but these are like the most common list of signs and symptoms that we encounter mainly for patients with adrenal insufficiency. So the most common one is fatigue, and then you have weight loss. These are mainly, primarily evident for patients with primary adrenal insufficiency or Addisons disease. Hyperpigmentation is very common for primary adrenal insufficiency, and this is because of the stimulation of the melanin due to the increased levels of ACTH from the pituitary gland. And then we have low blood pressure with increased postural drop. Postural drop, it's not necessarily evident with secondary and tertiary, but for primary adrenal insufficiency, you can see this because of the mineralocorticoid affectation, or we call it the hormone called aldosterone that is responsible for salt and water balance and blood pressure regulation. And then we have as well the postural dizziness, abdominal discomfort, and for routine laboratory tests, most of the time patients get diagnosed with a disease because they've already had an adrenal crisis or they felt unwell. They went to emergency department, they had some blood tests, and they found out to have low sodium and high potassium. And oftentimes as well, you get low blood sugar levels. So we have this Endocrine Society clinical practice guideline, which is that guides clinicians to diagnose and treat primary adrenal insufficiency. But just to highlight as well, I'm sorry it's not on the slide here, but we have the new NICE guidelines. So it's the national guidelines that we use here in the UK, and it can also be applicable, I guess, transferable worldwide in terms of managing and monitoring patients with adrenal insufficiency. And the treatment, the most common one is hydrocortisone 20 to 30 milligrams daily dose. And I know that in some countries, hydrocortisone is quite challenging to acquire, so they get treated with prednisolone. So in some patients as well here in the UK, they don't get on well with hydrocortisone, or the metabolism is quite fast, so there's some kind of issues with that. So they work better with prednisolone. And the usual dose is 3 to 5 milligrams daily dose. And fludrocortisone, this is the replacement for the hormone that I mentioned earlier called aldosterone. And this is primarily for patients with primary adrenal insufficiency. So now, what is sick day rules or stress day rules? So this is basically an event in which you will need to have a higher dose of steroids. And I classify it mainly to two types. So it's quite simple: sick day rule number 1 and sick day rule number 2. So sick day rule number 1 is when you have to take an extra dose of hydrocortisone or prednisolone, and sick day rule number 2 is when you have to administer 100 milligrams of hydrocortisone injection. So why do we need to increase cortisol intake? So you can see that image there below. That is the cortisol secretion rhythm. So that's the usual rhythm though. So it works with your body clock, basically. That's how we understand it, the secretion. So the peak secretion time is between 8 to 10 in the morning, and then it gradually declines throughout the evening so you can sleep. So this is the average normal cortisol secretion rhythm. So for example, like myself who hasn't got adrenal insufficiency, this is how my cortisol level should or rhythm should look like. Unless if I'm going partying, so it might be different. Yeah. So it varies as well and depends on your activity. So for patients who have adrenal insufficiency, our aim is to try to mimic this cortisol rhythm. So that's why you probably think, oh, why am I taking 10, 5, and 5 of hydrocortisone? So hydrocortisone is a short-acting type of cortisol replacement. So that's why you take higher in the morning because we need to get that level that you need in the morning, and then in the evening it then gradually weans down because we want you to sleep at night as well. So in people with different lifestyle, they go into night shifts, or so their daily routine is they're awake at night. So we just have to flip it over basically. So they start the high dose when they wake up in the afternoon, and then try to get that rhythm. So why we need this? Because during stressful situation, although this is the normal rhythm, your body naturally produces twice or 5 times or more, depends on how much you need in that particular situation. So, for example, when you're having an infection, you're in a stressful situation, like you're involved in a car crash. So your body is on a fight or flight mode. So you need that energy to keep your body going. So the cortisol will help to maintain your blood pressure and circulation, getting the oxygen to the brain, getting all the bodily function going. So the problem with patients with adrenal insufficiency is obviously you don't have that capability. So I always say this, like before, if you were an automatic car, so now we changed the engine to manual. So we manual it, we have to change the gears to like from first, second to third, fourth. So we have to adjust it. Hence, we need to increase the cortisol intake. And this is basically to prevent a life-threatening event called an adrenal crisis. So the questions now is, when do we need to increase it? So there are so many situations where you need to increase your cortisol intake, and this varies from person to person, depends on the situation. But the most common one is if you become unwell, you have increased body temperature, and usually it's above 38 degrees with flu-like symptoms. You have intense psychological stress like bereavement, diarrhea, with or without vomiting, um, day surgeries of these procedures like dental work, or gastrointestinal investigations like endoscopy, colonoscopy, planned surgeries. So we have guides for that, for surgical guides. I believe the Addisons Disease SelfHelp group has very clear guideline for that as well on their website. And then for accident or trauma injury, so in injuries, physical injuries that you think you need to take an extra dose of hydrocortisone. But just to take note, just to highlight that, basically general day-to-day stresses or a mild cold, this does not indicate for a cortisol intake. I know sometimes, we go to the hospital, for example, and then our clinician tells us, oh, you've got adrenal insufficiency, you're at risk of adrenal crisis. If you don't increase your hydrocortisone, you might die. So these are like very scary, right? So you get like, oh no, there's a possibility, there's a life-threatening situation. So when you feel like slightly stressed, patients tend to be like get anxious about it, and then just keep on taking steroids. And I've got a patient once, and happens all the time. And then after some time, he didn't get the side effects of steroids of gaining weight. So we just have to be careful. So if you're not sure, and if you need to clarify regarding how you're doing increasing your dose, please do speak to your healthcare practitioner to have the clarification. Don't be afraid. Or you can speak to Addisons Disease Health Group as well, the Pituitary Foundation, just to clear the books, basically. So how do we increase your cortisol intake? So the situations that I've mentioned earlier, so you can see there the table situation, you get action to take, and then the duration. You can also see this from the Pituitary Foundation website. We've just updated recently the guides. This is quite a long table there. We've added the surgical advice as well as pregnancy advice. So it's all laid out there. So you get the situation, for example, temperature increase to 38 degrees. So the action to take is to take extra 20 milligrams of hydrocortisone, then 10 milligrams every 6 hours, or prednisone 10 milligrams per day. For some patients, this might be confusing. Okay, so I know that we're like, okay, so take 20 milligrams, then really 10 milligrams every 6 hours. So there's no wrong as well. There's no harm if you prefer to just double the dose of your steroids like the way you do. So for example, in the morning you take 20, then at lunchtime you take 10, in the evening you take 10. And the reason why we just say this, every 6 hours is for us to have a cover for the whole 24-hour period. Because there are some cases where patients get more unwell in the evening, and we thought maybe they need more support as well in the like at 2 in the morning. So perhaps the hydrocortisone dose is going in the down in the lower level. So this is the reason why we also give this advice that you can do. But again, there's no sort of like written black and white that this is a must. Yeah. So I say this to my patients. You know your body, and you know when or you know what's the best way in order for you to prevent an adrenal crisis and to support your body during that stressful situation. So I'm not gonna go through that in detail, all of it, because otherwise we're gonna stare all night, unless you want me to keep talking. But so recognizing an adrenal crisis. This, excuse me. So many people always say to me that they can't really pinpoint like which ones which are the symptoms of adrenal crisis. And this words here that you can see in that box came out from my recent research study, and it's quite consistent with what the other studies also reported. For example, you can see the very big vomiting. So I think we all know by now that gastrointestinal symptoms, vomiting is one of the precursor symptoms for adrenal crisis. So patients who have vomiting, don't hesitate, give an injection. So lethargy and responsiveness, there's quite pretty obvious. Nausea, usually it's a combination of things. So you have nausea, vomiting, some will feel lightheaded, they get slurred speech, they feel like they're drunk. But there are some cases where they just don't know at all. I've had a few patients where they just suddenly collapse. And I think this is where the main challenge is for some patients, especially if they live alone. And I just say to them, perhaps if you have someone that you could, a friend or someone that could help you, maybe something that you can press, or your phone that you could send some emergency help. So we know that we have so many tools available to help us as well in terms of tracking the symptoms, recognizing the adrenal crisis signs. So, and it's very individualized. So I can't say to you that, this is definitely the precursor symptoms, but the symptoms that you can see on this box are the most common symptoms. And I think it's very helpful to be aware of that and to know about these symptoms. So now what do we need to do if we get an adrenal crisis? So we always say inject, call, and get emergency medical support. So we inject hydrocortisone 100 milligrams in the muscle. So we have, in the UK, we have two different types of preparations, the powdered form and the liquid form, but depends on the availability, basically. Sometimes the liquid form is always out of stock. And then we call our NHS 111 or 999. So I'm not sure in some other countries what emergency helpline you have. But in some cases, I would say to my patients, if you know that you're going through the crisis, if you've given the injection, rather than waiting for ambulance, if there's someone that can take you to the hospital, just go to the hospital rather than, because sometimes if you give an injection and you feel, most of the patients, they feel okay. Yeah. But then you don't know what will happen in the next 2 to 3 hours, whether you'll have another crisis or not. and then seek emergency medical support. And the reason why, because you were unwell, and the reason why you gave the injection was because you 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 were in the impending adrenal crisis. So you probably need some more fluids. You probably need to check electrolytes. So get some emergency medical support. Okay, I'm not sure if I'm still on time. So let's go to the frequently asked questions. Um, so these are the top five. So one is, how long do I updose for? Do I have to go to hospital if I've used my emergency injection? Um, how do you know when you're going into an adrenal crisis? Updosing and exercise and not having an emergency injection kit. So we're gonna go through that in detail. So the first question is, how long do I updose for? So there's two sub-questions here. One is, what's the longest you should take a double dose of hydrocortisone? So it's always depend on the situation. So I've shown you earlier the matrix, the grid, as to like, for example, if it's a high temperature, so you can increase your dose for 24 to 48 hours. And then if you're still unwell, you just have to call seek for medical advice, whether you need some antibiotics or need some further investigations. Or if you're still not better, then obviously you just have to carry on for that. And I think that goes with the next question of, what's the maximum time limit you can do that for in terms of updosing. There's nothing written in stone as to what's the maximum time. But if you've already been taking the steroids for a week, like updosing your steroids for a week, so that means you definitely need some medical assessment, because we need to go to the root cause. So I would suggest to call your endocrine, if you have an endocrine specialist nurse, call them. Um, Ask for what you need to do with your steroids at that time. Because some patients, even if you still have the infection, you're on antibiotics for 2 weeks, yeah? After 1 week of updosing, you probably feel better already. You don't have symptoms of high temperature. You don't have, uh, you're not as unwell as before. So perhaps we can then try to taper down your steroids. So I think with my practice, the maximum that I've had with my patient is 2 weeks. That was the longest I've done to my patient. That I've given advice in terms of maximum time limit, but there's no like written, like in terms of black and white guide, like this is the maximum. You can't increase your dose anymore. That's it. Um, yeah. But yeah, discuss with your endocrine team regarding this once you've already increasing your dose for more than a week. Okay. So this is, so it says like up dose for 48 hours. If you're feeling better, I think I've already answered this earlier. So yeah, this is just some of the guide here. So you can have a look at this as well from the website of Addisons Disease Help Group, and please do check the matrix as well from the Pituitary Foundation. Okay, so the next question is, do I have to go to hospital if I've used my emergency injection? So I would always say to my patient, depends why you've used the injection. But in most cases, yes. I always advise a patient to seek an emergency advice or medical advice. Um, some of the patients, they do have, for example, they vomited twice or thrice, and it could be because they've eaten something. Yeah, and at that time, when it's time for the dose, for example, morning dose, they've eaten something the night before, they vomited, they can't take in the tablet. They gave the injection. After an hour, they feel okay. There's no more vomiting, and the there's no temperatures, no other symptoms. Then, if the vomiting doesn't persist, then some patients, I would say, okay, just observe yourself And then if there's still vomiting that's persistent, then just you have to definitely go. But in general practice, I always say to my patients that the reason why you give the injection is because you were unwell in the first place. So it's always necessary to go to the hospital. So yeah. So for example, I have a patient with pseudo seizures. Yes, pseudo seizures, and it's not like the actual seizures, but it's the psychological type of seizures. And he he administered the injection after the pseudo-seizure. So after the injection, he feels okay. There's no seizures, there's no vomiting, and we know that it's a pseudo-seizure because it's established. They said, okay, so that's fine. I mean, if there's no another seizure episode, you don't necessarily go. But it's really case-to-case basis, and it's in rare cases that we advise that. But most patients with adrenal crisis or impending adrenal crisis, they definitely need to have a medical assessment, and you need to be seen in the emergency department as much as, because the last thing you want to happen is you give the injection, you feel better, yeah, and then after 2 hours you stayed at home, you had another crisis, and then you waited for an ambulance. So it's just a whole stress for you as well. So yeah, don't hesitate. And I do understand. I've had patients that saying, I feel bad, like I'm just wasting your time. Um, I always say to my patient, I think we have to be careful here to make sure that you're not really wasting people's time. So we have to clear on that. What we want to make sure is that you are safe and that you have given the right treatment. So, should we use our own blood pressure monitor to assess? If so, what reading should we see on a blood pressure monitor? So, yes, you can use your own blood pressure monitor to assess. It's You can use that. The blood pressure during an adrenal crisis, we always look at less than, I would say, less than 100 systolic, and less than 70 diastolic. And so yeah, so during adrenal crisis, it's usually below than that. Sometimes it's even like around 80s, 80 over 50, if it's really full-blown adrenal crisis. Okay, so how do you know when you're going into an adrenal crisis? So the first question is, how do you know when, so how does a crisis manifest itself? How will I know? So these are the questions, and what are the signs and symptoms that the body requires more steroid daily than prescribed. So you can see here on the side, see like feeling dizzy when sitting or standing. These are the symptoms that you have to watch out for, and it manifests differently per person. And I can only say that it's only you who can say that. I can't really say to you that these are going to be these are going to be the symptoms that you'll be experiencing. Because again, some patients may feel only confusion and brain fog, and then all of a sudden they just lost consciousness. Some people will feeling dizzy when sitting or standing. Some people will have this like weird sort of light that passes through their eyes, sort of like that, and then they know that that's their that they're going to in crisis. So what they'll do is they prepare the injection kits, and then they will sit down somewhere and then get it ready. And then when they go to the next level, then at least they're ready. Some people as well, while they're feeling that symptom, they will try to take extra hydrocortisone, like 10 milligrams, see how they feel, observe themselves in the next 30 minutes or so. And then if they feel okay, then that means they don't need to give the injection if the symptoms does not progress. So again, it's not written black and white. So it really differs per patient. Okay, so I guess all these questions, that's the answer there on the side. And how do you know when you're going into an adrenal crisis? Again, there are different scenarios, so you can have a look on other people's stories. So I think that's That's one of the benefits if you are a member of a patient advisory group like the Addisons SelfHelp group and the Pituitary Foundation, because you will be able to hear other people's stories, how they manage their condition, what are the symptoms they experience, and then some of them, although maybe different than what you have, but or perhaps you are someone who hasn't had an adrenal crisis before, but at least you will be aware that there are varieties of symptoms and it can present differently per patient. And we can say as well, we have Addison's disease patient who hasn't had adrenal crisis for 30 years, or throughout their life, they haven't had adrenal crisis. So they would never really know like what symptoms they would experience, although because they know that when to increase the dose of their steroids, they seek the rules, so that helps them in terms of preventing from going to the full-blown crisis. And so you can check out these personal experiences through our websites. So you can see there, and we got Philippa's story as well, stomach bug. So that there, and yeah, so you have Dan's story with the crisis. So we have varieties. And in some of our support meetings as well, if you attend one of those support meetings, you can meet people with adrenal insufficiency from different pathologies. So it would be, I'm sure it's a very beneficial thing to do, to hear these stories and learn from each other. So, updosing and exercise. More advice, please, about take the rules and exercise. So, generally, walking does not seem to be included for extra dosing, as it's not strenuous. So, however, walking can be strenuous for those with other conditions, especially with respiratory ones. So again, it's individually tailored, so it's really differs per person. So if, for example, like for me, running probably is not stressful for me, but for someone who's got chronic fatigue syndrome plus Addison's disease, it might be something that is quite stressful. Yeah, so doing like even just a 1K jogging might be stressful for them. So we don't necessarily advise them to take extra dose of hydrocortisone during exercise, but again, depends on the level of exercise as well. So I've had a patient with adrenal insufficiency, and she said I'm actually doing some. She said I'm doing some CrossFit exercises. I don't know why she does that, but yeah, she was. So I said, okay, how often do you do that? Because I don't really allow you to do that every day. So good thing she only does it every week. So I said, okay, so you can take like 30 minutes before your workout, take extra 10 milligrams. But please, if you can just, consider other type of less stressful activity. But yeah, I can't stop people from doing what they want to do. Um, so yeah, so speak to your clinician. What's the best advice regarding this? But in general, we don't really advise patients to take extra dosing during general exercise. For example, if you go for like a 5-minute walk on a treadmill or like a slow jog, and that's okay for you, you feel okay with it, so it's fine. Just make sure you're well hydrated. Just make sure if it's really high temperature, like sorry, in the heat of summer. So just make sure you don't stay too long out in the sun and really dehydrated. So that's just one of the other advice as well. Not having an injection kit, I would definitely advise that if possible, please have an injection kit. So there is one of these statements here that's been diagnosed for 5 months and still don't have emergency kit. And there's a waiting list. So the Addisons SelfHelp group and the Pituitary Foundation do have emergency injection kits, although it doesn't have the medication. But I think like because of staff shortages, you didn't have the emergency. I don't see it as an acceptable reason, really. I'm really sorry whoever wrote this, that I can only apologize from the clinical staff behalf. But do speak to your GP. I know it takes a lot sometimes to self-advocate, but for for patients with rare diseases, it's just that sometimes we need a bit of a push to some of the clinicians to get the right medication for us. And if you haven't got your steroid injection kit right now, perhaps tomorrow do get it, because the thing is you'll never know when you're gonna need it. Um, we do have patients who have adrenal insufficiency for some time and they were fine, and all of a sudden things changed. They just had a crisis. So yeah, but yeah, please do. So nowadays, because of the awareness that we raise across in the UK, so I believe we're going a bit better on this now. We have paramedics who are also aware of the condition, so we have trainings for GPs and other healthcare professionals, and the awareness that we provide throughout the country. So yeah, so there's no excuse really for this. I'm really sorry I ever wrote this one. Okay, so yeah, so this is how the injection kit looks like, the Pituitary Foundation here, and that's the Addison SelfHelp group. So yeah, so check out the website. You can actually buy those kits. Although yeah, there's no medication in it, but your GPs can prescribe the medication, the hydrocortisone 100 milligrams. And yeah, shouldn't be a problem because they should be allowed to prescribe those. Okay, thank you very much. And if you have any other questions of things that I haven't covered, so I guess we have more time to discuss that.
We do. Thank you so, so much. That was absolutely amazing. Yeah, so on the emergency kit question, I really on both of our websites, we've got step-by-step guidance of what you can do, and links and letters and stuff that you can send to your GP to build on what Aldon said there for us. So get those emergency injection kits, as he said. Very, very important. So I think from all of us, then we just want to say a huge thank you to Aldons and to everyone else for joining us this evening. It's been fantastic. At our max, there's been 204 of you, so I think we can safely say there, never feel alone. There's all of us, and please reach out to us. So from the Addisons Disease Self-Help Group, thank you so much, and Pituitary Foundation.
From the Pituitary Foundation, thank you so much from Nesta and Pat and Aldons. Thank you.
Thank you. Thank you so much, everyone. And sorry if I didn't answer all your questions there in the chat. We will have more opportunities next time.